So now we'll be starting with transportation injury. When we discuss transportation injury, you always think about road traffic injury, but it is not only road traffic injury, it includes injuries due to the accidents in the air and the water. But primarily we'll be discussing on the injuries in the road traffic accident. But under this discussion, we need to have two important discussion. Number one, injury to pedestrian. Number two, it is the injuries due to the occupant of the vehicle. Okay, outside the road, inside the vehicle. Okay, so we'll be discussing on that. First, let's start pedestrian injury. The injury in the pedestrian, it depends on various factors. Number one, depending on the side of the impact, which side the impact was, whether it is lateral side or it is back. So the injuries will differ accordingly. Not only that, it also depends on the type of the vehicle, whether it is a car or it is bus or lorry. Okay, it depends on the type of the vehicle. And not only that, the speed of the vehicle also matters. The most importantly, we need to remember the point of impact, whether it is above the center of gravity or it is below the center of gravity. You can see that if it is below the center of gravity, what happens? The person will be scooped up, he'll be falling on the vehicle, he can sustain injury. Suppose if it is above the center of gravity, the person will be pushed down on the road, there may be run over injury or any other injury depending on the vehicle. Right? So do remember, these are all the different factors that will influence the appearance of the injuries in the pedestrian. But still, let us talk about the classical injury. Let us say there is a car and the person is walking on the road. There is an impact from behind. Let us have a classical example so that we will understand the type of injuries that are possible. Number one, let us say this is the person who's pedestrian walking on the road and there is a vehicle which is impacting from the back of the person. This is first impact with the vehicle. After this, you can see that the point of impact is below the center of gravity. You can say normally the center of gravity is in the back of the sacral area. Okay, pubic area. Now here you can see this is the point of impact is below the center of gravity. The person will be scooped up on the vehicle. This is second point of impact with the vehicle. Okay, first point of impact, second point of impact. Now the person will slide on the vehicle, falling on the road and he is dragged on the road. Okay, you can see this is ground impact. I told you this is first impact with the vehicle, this is second impact with the vehicle and this is ground impact of the person. Fine. So these are the three impacts that we need to keep in mind to understand the nature of injuries that are possible. Fine. So let us discuss about that. You can see this is first impact. Okay. And this is second impact. And this is ground impact. Fine. So you can see first impact, second impact, impact with the ground. Keep that in mind. If the injuries due to first impact with the vehicle or if it is second impact with the vehicle or it is ground impact, the terms will differ. If it is due to first impact with the vehicle, it is called primary impact injuries. First impact is primary impact. Very simple. The person falls on the vehicle. You can see that the person might fall on the windshield or bonnet, okay, or any other part of the vehicle. Fine, windshield or bonnet usually. Wherein the person will have some injuries, we call it as secondary impact injuries. When the person falls on the ground, we call it as tertiary impact injury, that is due to ground impact. It is called tertiary impact injury, which is also called as secondary injury. Do remember, this is not secondary impact. Make yourself clear, this is secondary injury. This is secondary injury. Right? Make a note of this, guys. So you have primary impact injury, this is secondary impact injury, and you also have secondary injury, which is otherwise called as tertiary impact injury. Very, very simple. Now let us see the first impact with the vehicle. Right? Vehicle is coming from back. There is first impact with the vehicle. You can see this is first impact with the vehicle. Now normally what happens, you can see, right, the bumper hitting the part of the vehicle, part of the person. Right? When the bumper is hitting the leg of the person, the injuries produced are called as bumper injury. I told you this is primary impact and which is normally due to the impact of the bumper. That's why it is called bumper injury. What are the injuries that are possible? You may have abrasion, you may have contusion, you may also have laceration and fracture as well. Right? And do remember, you can also have internal hemorrhages. And that is the reason why normally whenever we get a road traffic accident victim, we have to normally dissect the calf region and find out whether there is an internal injuries present or not. Maybe it is not visible outside, but internally you'll find a lot of injuries inside. That is because of the bumper impact. Okay, that is because of the bumper impact. Do remember, it is called bumper injury. Bumper impact, bumper injury is very easy, right? And this is the first impact with the vehicle. Fine, this is the first impact with the vehicle. It is usually, it is legs, right? It is usually present at the level of legs. Not always, not always. Why? Why it is not always? That is because it depends on the height of the vehicle and the height of the person. If it is, if the person happens to be an adult, you can say it is at the level of legs, right? And you will find fracture in the tibia. If it is children, what happens, right? You may find the fracture in the femur, right? So it all depends on the height of the victim and the height of the pedestrian. You can see that this is the impact with the vehicle bumper. You can see there is a fracture in the tibia, and this fracture is called as bumper fracture. This is called bumper fracture. Fine. When you are looking at the bumper fracture, do remember there are two things that we have to notice. Number one, you need to see the side of the impact. It will tell us the direction of vehicle. Not only that, you also have to look at the level height of the bumper injury. You also need to look at the height of the bumper injury. Why we should look at the height of the bumper injury? That will tell us an approximate idea. That will tell us an approximate idea about the height of the bumper, height of the impact area from the ground, right? This will give us an approximate idea about this height. If the vehicle was braking, it may be at the lower level also, because the vehicle will dip down when there is sudden brake. When it will dip down and you can get the bumper injury little down. But what is so important is look at the shape of the bumper fracture. That is again very, very important. Look at the shape of the bumper fracture. You can see this is wedge or triangular. This is wedge or triangular. Why is it so important? That is because you can see the base, right? Let us say this is the fracture. The base of the triangle will tell us the impact side. It will tell us the impact side, whereas the tip of the triangle, the apex of the triangle will tell us the direction in which the vehicle was traveling. It will tell us the direction of the vehicle, and that is the reason why we need to have a look at this bumper fracture. We need to examine the bumper fracture because it gives us so many information, right? The tip will tell us the direction and the base will tell us the site of impact. Okay, so we were discussing about primary impact injury, the first impact. Now let us say the person falling on the vehicle. I told you he might fall on the windshield or bonnet, wherein the person can sustain injuries, right? Depending on whichever body part is falling on the vehicle, you can have injury. The person may commonly have head injury as well. Fine. Second impact with the vehicle, secondary impact injuries, right? When the person falling on the ground, you call it as tertiary impact injury, also called a secondary injury. This is when the person falls on the hard surface of the road. The person falls on the hard surface of the road. This is when the person can have head injury. This is when the person can have head injury. Not only that, he'll be dragged on the rough road. You know very well there is a rough road. Dragging on the rough road can cause extensive abrasions and lacerations. The person can have extensive abrasions, laceration. There may also be multiple fractures. All this is due to ground impact. We call it as secondary injury, also called as tertiary impact injury. Fine. So do remember, I told you primary impact, secondary impact and tertiary impact. Now we have to discuss about two important type of injury. Number one, we have got what is called as run over injury. And there is one more type that is called rolling injury. What do you mean by run over and rolling injury? Any vehicle with a high chassis, can cause run over. Fine. Because you can see that this is a vehicle with a high chassis. You can see there is a gap, right? There is a gap. What happens here? Here when the high chassis vehicle is passing, it will cause run over of the victim. It will cause run over injury of the victim. This is running over. What are the injuries possible? You can get tire mark. You can get tire mark. Right? This is run over. So typically you will find tire mark. Not only that, you will find crush injury. Crushing injuries can be noted. We can find avulsion laceration that we discussed earlier. In any run over injury, you will get avulsion laceration. And not only that, we can also find amputation of the limbs as well. Right? If it is heavy vehicle, sometime amputation of the limbs can also be noted. All this is seen with run over injury. Fine. And what about rolling injury? Rolling injury is something where that is seen with vehicle with a low chassis. That is seen with a low chassis. What happens here? You can see this is a vehicle with a low chassis. So it cannot run over. What happens is, you can see if this is the vehicle and the victim is over there, as the vehicle keeps moving, the victim will be rolled on the road. You can see that the victim will be rolled on the road. There is a gap between under surface of the chassis and the road. Within this gap, this victim will keep on rolling. We call it as rolling over injury. Right? This is called rolling over injury. When the person is rolled over like this, what happens? You can have circumferential injuries. You can have all around the circumference of the body, you can have circumferential injury that are noted. Circumferential injuries can be noted. You can have lacerations, you can have abrasions. Right? Not only that, because of the contact with the underside of these chassis, you can expect grease marks. You can expect grease marks in this area. Fine. So this is basically rolling injury. Right? I told you, vehicle with a high chassis, vehicle with a low chassis, vehicle with high chassis cause run over, and vehicle with low chassis that cause rolling over. You can see that this is rolling over. Okay. So far we were discussing about injury to pedestrian. Now we'll be discussing about injury to occupant of the car. Right? Occupant of the car. Let us assume the person is sitting inside the car going at a high speed, suddenly hitting the median divider. Right? Suddenly hitting the median divider or any other stationary object, the person can get injuries primarily due to three factors. What are they? Number one, that is sudden deceleration. Going at a high speed, sudden stoppage, deceleration injury. Or there can be secondary accident. What is it, secondary accident? Secondary accident, I'll show you. You can see that this is sudden deceleration. Sudden stop. Or when the person is going at a high speed, suddenly hitting a stationary object, the person who's sitting inside the car will hit the different parts of the vehicle. That is called secondary accident, because of which the person can get injury. Right? This is secondary accident. Or the third one is due to seat belt. Okay, so these are the three various factors which will help us to determine the injuries which are possible. We'll discuss about that. And these are the factors which are responsible for the injuries, and that we'll be discussing now. Okay, so we'll discuss one by one. Let us assume the person is going at a high speed hitting a stationary object. When the person go at a high speed, suddenly come to a sudden stoppage, what happens? The victim will tend to go forward. Right? Victim cannot come to sudden stop and the vehicle stops. Right? When the vehicle come to sudden stop, victim may tend to go forward, particularly if he is not unrestrained by the seat belt. If it is unrestrained, you can see the face will go and ram into the windshield. You can see face go and ram into the windshield. Not only that, there can be severe movement in the neck. You can have hyperextension followed by flexion, or there can be hyperflexion followed by extension. Right? Then you have steering wheel that will hit the chest. The person can have injuries in the chest. Not only that, when the person is going forward, something from the back is pulling him behind. That is nothing but seat belt. Seat belt will also produce some injuries. That is seat belt injuries. Right? And of course, the person's leg will be placed on the foot. Foot is placed on the brake or clutch. That may also cause certain injuries. These are the different levels the person may have injury, the victim may have injuries, particularly if he happens to be a driver. And we'll be discussing the injuries in all these levels. To start with, let us start with the windshield. Let's start with the windshield. I told you, the person, when he's unrestrained, the face will go and ram into the windshield. The person may have multiple cut lacerations. You can have multiple cut injuries on the face, right? Because of the broken windshield, broken glasses, the person can have multiple cut lacerations on the face. Not only on the face but also in the neck. It depends on whichever body part is exposed. Not specifically only to the face. Whichever body part is exposed. Commonly the face is exposed, so we are talking about face. Multiple cut lacerations on the face. We call this as sparrow foot injuries. We call this as sparrow foot injuries because it looks like a mark of the sparrow foot. That's why it is called sparrow foot injuries, right? Sparrow foot injuries, right? Nowadays, like this kind of injuries are not that common because of the nature of the windshield that is produced in the cars, right? You can see that is multiple layered, it is laminated, it doesn't get broken into multiple pieces like this. When it is broken, we will get some injuries like this. This is called sparrow foot injury. These are called sparrow foot injuries. The next level is neck. I would like to show you the sparrow foot injuries. These are sparrow foot injuries. You can see the sparrow foot injuries on the face, right? The next level is neck. I told you the person neck will go for extension and flexion or flexion extension. Differential movement will be there. So the neck can go for hyperextension and flexion or flexion and extension. Differential movement will be there depending on what type of trauma it is. Normally what happens, the neck will get injured whenever there is acceleration, deceleration trauma. What is that acceleration, deceleration? You can see here the vehicle is stopped. The driver has parked the vehicle at the side of the road and he is sitting inside the car. What happens? Suddenly the lorry is coming and hitting from the back. Right? So this is sudden acceleration. When there is sudden acceleration, there is hyperextension followed by flexion. Right? Hyperextension followed by flexion. Suppose if the person is going at a high speed, hitting the median divider, vehicle come to sudden stop, hyperflexion followed by extension. So these kind of differential movement will produce certain injury in the neck. We call it as whiplash injury. Right? Whiplash injury. Why this is called whiplash? Because the differential movement looking like a movement of the whip. That's why it is called whiplash injury, wherein the person can get soft tissue contusions of the neck. Not only soft tissue contusions, sometimes there can also be spinal cord contusions as well. Right. Normally there is no fracture, but sometimes fractures can also be noted at the cervical level. Right? You can see these are called as whiplash injury. Right? You can see when there is sudden hyperextension, the anterior longitudinal ligament may get injured. If there is sudden hyperflexion, this kind of posteriorly the ligament will get injured. So both kind of injuries are possible depending on the nature of the movement in the neck. We call it as whiplash injury. I told you this is due to acceleration and deceleration. Fine. Now going forward, the next level I told you that is in the neck. After that we have in the chest, which is basically due to steering wheel impact. Right? The steering wheel impact on the chest. The person can have patterned bruise, that is due to steering wheel. Pattern bruise may be there. There may also be fracture of the sternum. You can find the fracture of sternum. There can be, we are holding the steering wheel with the hand, right? So there can be fracture of wrist, right? The forearm bones can also be fractured. So all these fractures are possible with the steering wheel impact. Remember, these are all steering wheel impact injuries, right? The next injury is due to sudden deceleration. When the person suddenly decelerates, what happens? There can be injury to the deceleration. When there is sudden deceleration impact, there can be injury to the aorta. That is highly important. There can be injury to the aorta. You can see particularly there can be aortic rupture involving isthmus. Usually it is seen in the isthmus. Right? You can see this is the arch of aorta. Right? You can see this is the arch of aorta. What happens is this is when you have this vessels, and this is where you have the isthmus, and the rupture is very, very common over this area. Rupture is very common in this area. That is because the ligamentum arteriosum getting attached to that particular area, right? You can see the root, right? You can see the root of heart is free here. When there is a sudden deceleration movement, this area will be keeping on moving, and this is the only restrained area that will get ruptured. Okay, because of the differential movement of the root of aorta, the arch of aorta that is restrained by the ligamentum arteriosum, that can cause rupture of the aorta. So when you have the aorta, you can see this is the arch of aorta, right? This is the arch of aorta. This is the isthmus, right? This is the area that is more prone for rupture. Why isthmus is more prone for rupture? That is because you can see that is a place that is restrained by the attachment. That is ligamentum arteriosum, that is it restrained. The root of the heart and the other place where when there is a differential movement of the chest, what happens? That will move, sudden deceleration, and this is the place that is restrained. You can get a rupture in that area, right? That is where it is very commonly seen. Fine. Not only that, when you look at the aorta, you can also see transverse tear in the aorta. You can find transverse tear in the aorta. You can see transverse tear in the aorta that looks like the rung of the ladder. That is the reason why it is called ladder rung tears. It's called ladder rung tears. It looks like a rung of the ladder. That's why it is called ladder rung tears. We also find aortic rupture. Not only that, ladder rung tears also possible. That is due to deceleration impact. Fine. And then you have what is called a seat belt, right? Because of the seat belt, when the person is going forward, seat belt is something which is pushing him back. You can see that seat belt can also cause injuries. Right? What are the different mechanisms by which it can cause injuries? Number one, it can be due to direct compression. Number one. Or it can also cause deceleration. Not only that, it can as well cause flexion distraction injury. Right? These are the three things that can cause injury due to seat belt. When there is a direct compression, remember, it can cause seat belt bruise. Not only that, there can also be intra-abdominal injuries, direct pressure on the chest. Intra-abdominal injuries. Right? Intra-abdominal injury. Fine. And I told you, sudden deceleration. Deceleration can cause injury, right? It can cause injury to the mesentery, the most common organ. Do remember, the most common organ to be injured is mesentery, right? Following mesentery, we have small intestine. Right? There can be tear in the mesentery. There can also be small intestine injuries. Right? Why there is mesentery getting injured more often in deceleration? When there is a sudden deceleration, what happens? The small intestine, which is so longer, that is about 6 meters, tend to go forward. The small intestine is anchored to the posterior abdominal wall only by the mesentery, which is hardly around 6 inches. Right? You know, the root of mesentery is hardly around 6 inches, which is going to anchor the small intestine. When the small intestine tend to go forward, it is tearing away the mesentery as well. That is the reason why it is most commonly injured. The third type of trauma is flexion distraction injury. This flexion distraction injury very, very commonly associated with lap belt type, where there is person flexing, hyperflexion over the seat belt. You can have what is called as flexion distraction injury, right? The vertebral column will be going for flexion distraction, wherein we find what is called as chance fracture. We call it as chance fracture. Okay. I'll show you the chance fracture. You need to have a look at it. So this is the seat belt bruise. I told you direct compression. And this is flexion distraction injury, wherein you can see there is flexion. Because of the distraction, you can have what is called as chance fracture. There is a transverse fracture involving the posterior and the middle component. You can see what is called as chance fracture. Very, very common with regard to the lap belt type. Lap belt type. Fine. So remember, I told you seat belt bruise. I told you mesenteric rupture and a small intestine injury, that is because of deceleration. And the third one, flexion distraction injury, that is causing what is called as chance fracture. All this is due to seat belt. All this is due to seat belt. Fine. And the last type of injury that we have to know is, last type of impact that we have to know is nothing but your dashboard fracture. Right? Because of the dashboard impact, right? You can see because of the sudden deceleration, the knee of the person who is sitting in the seat will violently go and ram into the dashboard. Because of this impact, the person may have patellar fracture. Not only that, there can be a tear of the posterior cruciate ligament. There can be injury in the posterior cruciate ligament, which is more vulnerable in that kind of knee flexed position. And not only that, we can as well see the posterior dislocation of the hip. You can as well see the posterior dislocation of the hip, and this posterior dislocation of a hip, that is you see here, right? This is called as dashboard fracture. Fine. So these are all the various injuries that are possible with regard to the injury to the occupant of the car. Right? You can see starting from top, you can see windshield producing sparrow foot mark. You can see neck injury causing whiplash injury. The steering wheel can cause injury, pattern, bruise and different fractures are possible. And then you have deceleration trauma. I told you aortic rupture and ladder rung test. Seat belt can cause multiple injuries. The direct compression, deceleration and your flexion distraction injury. And finally, you have the dashboard impact that can cause dashboard fracture. In addition to that, there can be a patellar fracture and the posterior cruciate ligament tear. So all this is possible with regard to the occupants of the car. I did not specify whether the person is a driver or passenger. Now we'll be discussing on that. So let us summarize everything here. You can see the windshield causing sparrow foot marks. You can see neck, there is whiplash injury, steering wheel causing fracture and pattern bruise, deceleration, aortic injury and the isthmus rupture can be there. Seat belt injury, I told you the various seat belt injury, and the dashboard fracture, that is due to dashboard impact. Now let us talk about the driver and the front seat passenger. You can see sparrow foot mark is present with driver and the front seat passenger. Whiplash injury is seen with driver and passenger. Steering wheel is seen with driver but not front seat passenger. Fine. And the deceleration force, the aortic rupture can also be seen with both people, driver and the front seat passenger. Seat belt bruise is also, seat belt injuries are also common with driver and passenger, but dashboard impact is not common with regard to the driver, but it is possible with the front seat passenger. Fine. So with the appearance of all these injuries, we can find out whether the person is a driver or a front seat passenger. There is something called Waddell's triad. What is it, Waddell's triad? You can see there's a triad of, there is a fracture of femur. Not only that, there is intrathoracic or intra-abdominal injury due to the impact and contralateral head injury. This is commonly seen, this is the pattern of injury that is commonly seen with a pediatric pedestrian hit by a car. When there is a pediatric pedestrian, you know the height is little lesser for the victim. The primary impact will be at the level of femur. Secondary impact will be to the chest or abdomen, wherein you can have intrathoracic or intra-abdominal injury. When the victim is thrown on the ground, the person can have contralateral head injury. Right? When you have this triad, this is called Waddell's triad, which is nothing but primary impact, secondary impact and tertiary impact. Primary impact, this is primary impact, this is secondary impact and this is tertiary impact, that is on the ground. Okay. So when this triad is there, you can say this is called Waddell's triad. This is called Waddell's triad. So now I'll be telling you one more important terminology, that is called tailgating. What is tailgating? Tailgating happens when a person drives a car very close with the lorry in front in national highway. The lorry heavy container is going in front and the car person is going back. There is very small gap between the lorry in front and the car in the back. Lorry is going faster, car is also going faster. Suddenly the lorry fellow applies brake. This person, car driver, is not able to apply brake. He go and collides the lorry in front. Right? He goes and rams into the tail end of the vehicle in front. He goes and collides. It is a collision with the tail end of the vehicle in front. That is called tailgating. This car person goes and run under the lorry itself. We call this as underrunning. We call this as underrunning. When the person hits the lorry in front, what happens? There can be severe facial injuries. You can see the facial injuries. Not only the facial injuries, if the impact is so severe, it can even cause decapitation. It not only causes facial injury, it can also cause decapitation depending on the impact, severity of the impact. And it is not applicable only with the car, it is even applicable for the two-wheeler as well. Okay, so this is basically collision with the vehicle in front. That is called tailgate. Right? You can have a look at it. You can see the car collides with the lorry in front. It runs under the vehicle itself. We call this as tailgate, also called as underrunning. Okay. Now let us see few more important terminology. Let's talk about concussion. What is basically concussion? Concussion is basically a transient stoppage of the function. Transient, it's reversible. Okay. It can affect different organs. If there is concussion of the brain, right, we call it as cerebral stunning. Cerebral stunning. Right? If there is a sudden blow to the head, the person, because of that blow, there is a transient LOC, transient loss of consciousness. Transient loss of consciousness. There is no macroscopic injury in this concussion. This is only a microscopic injury where there is a reversible loss of consciousness. Sometimes there can be amnesia associated with the cerebral concussion. We call it as cerebral stunning or concussion. Okay. The next one is heart. There can be concussion of the heart as well. The person, this is very commonly seen with the sports people, young athletes. What happens if there is a severe blunt trauma to the chest? If there is a severe blunt trauma to the chest, suddenly the person can die, right? Because of this concussion of the heart. We call this as commotio cordis. Commotio cordis. What is this? This is basically concussion of the heart. It may result in sudden death of the person, which is very commonly seen with sports people when there is a sudden blow to the chest. This is concussion of the heart. We can also get concussion of the spinal cord, right? So this is specifically seen with any violent impact to the back, where there can be impact of the spinal cord in the vertebral column, right? There can be loss of functions, or we can say loss of power cut. There can be violent impact of the spinal cord against the bony canal. What happens is the person can get transient weakness of the limbs. The spinal cord will collide within the vertebral canal, the bony canal. What happens is the person can have reversible weakness. There can be paralysis of the limbs. There can be paralysis of the limbs, but it is reversible. There can be loss of control of the bladder and the bowel movements. All this is seen with the concussion of the spinal cord. And do remember, the concussion of the spinal cord is also called as railway spine. They can ask you what is railway spine. Railway spine is nothing but the concussion of the spinal cord. It's very commonly seen with a heavy vehicle, heavy impact like a railway traffic accident, road traffic accident. That's why it is called as railway spine. Fine. There is one more concussion that is seen in the retina. If there is a blunt trauma to the eye, there can be concussion of the retina. What happens is the person will have transient loss of vision. Right? There can be a transient decrease in the vision that can happen. We call this as concussion of retina. Concussion of retina, also called as Berlin's edema. This is called as Berlin's edema. Specifically, we can see the white opacification of the particular patch of retina. Fine, we call this as Berlin's edema, which is nothing but the concussion of retina. I've told you about the concussion of brain, I've told you about the concussion of the spinal cord, I've told you about the concussion of the heart and the retina. So all this is basically concussion, and do remember, mostly concussion is a reversible loss of function. It's a reversible loss of function that we have to know. Now, let's talk about heart. Heart, the first thing is what we have to learn is cardiac tamponade. Cardiac tamponade, accumulation of the blood in the pericardial cavity causing diastolic dysfunction. Heart is not able to relax, the person dies. Here, what we have to know is, we just have to know one important triad, that is called Beck's triad. Right? What is this Beck's triad? Beck's triad is basically the triad of elevated JVP, right? It is muffled heart sounds. When you are examining, when you are auscultating, you are not able to auscultate the heart sound. That is muffled heart sound. That is because of the blood which is present in the pericardial chamber. When the blood is present in the pericardial chamber, when you auscultate, the heart sounds will appear muffled. Not only that, the person will also be having hypotension. There is poor cardiac output, low cardiac output. The person will present with hypotension. This is called Beck's triad. This is very important. Many times we get questions on this. They'll give you a history like this. Patient, 40-year-old man, coming with history of injury to the chest, presenting with elevated JVP, muffled heart sounds, and hypotension. What is the diagnosis, or how will you treat? We have to aspirate the blood. We can do what is called as pericardiocentesis. Do remember Beck's triad. So this is very important. We call it as cardiac tamponade. Fine. Then we have perforating injury. What is happening in the perforating injury of the heart? Do remember, the most common chamber, it is right ventricle. Right ventricle is the most common organ to be injured in stab injury heart. But do remember, the fatality of the, if you're talking about fatality of the stab injury of the heart, it is inversely proportional to the thickness of the heart. Right? What does it mean? The more the thickness of the chamber, the stab injury to that chamber will be less fatal. The fatality will be less. Right? For example, you have stab injury to the right ventricle. You also have stab injury to the left ventricle. Which is more fatal? Stab injury to the right ventricle will be more fatal than the left ventricle. That is because the more the thickness of the chamber, it is going to arrest the bleed, sealing the bleeding. When it is sealing the bleed, obviously the fatality will be less. Do remember, the fatality will be more when the thickness of the chamber is less. Right? When the thickness of chamber is less. For example, your right ventricle chamber is less. Right? Fatality will be more. So when you're talking about right ventricle stab injury and left ventricle stab injury, which is more fatal? The right ventricle stab injury will be more fatal than the left ventricle. So that is very important point to be remembered. Right? It is about the thickness of the wall of the chamber. Fine. Now coming to spleen. See, when you talk about spleen is the most common organ affected in blunt trauma abdomen. It is the most common organ. Affected in blunt injury abdomen. Right? Blunt injury abdomen. And when we are looking at the laceration, of the spleen, we find what is called as alphabetical laceration. When you look at the laceration, it will look as if it is an alphabet, Y, L, something like that. We call this as alphabetical laceration. Alphabetical lacerations are commonly noted in spleen only. Right? To remember, it is an alphabetical laceration. Fine. Then we have spinal cord. See, the most common part of the spinal cord that is commonly injured is cervical. Cervical is most commonly injured. Cervical part of spinal cord is most commonly injured, and particularly if it is C4 level, it is highly fatal. Right? It is C4 level, it is highly fatal. We have already discussed with regard to spinal cord, we have already discussed about whiplash injury. I have also told you about railway spine. So do just remember about the whiplash injury and the railway spine. Fine. Let's talk about Ewing's postulate. What is this Ewing postulate? Ewing postulate is something that is actually telling us a relationship between trauma and the tumor. Fine. So this is actually the postulates about the trauma and the tumor, relationship between the trauma and tumor. In case if there is a victim, the victim got sustained an injury in the left forearm. After few months, that injury got healed. After few months, in the same place, the tumor, there was a malignancy which appeared. Now the victim is alleging that the malignancy, the tumor which appeared in that side, it is because of the trauma he sustained few months back. Fine. So he is alleging that the trauma is the reason for the tumor. Whether it is the trauma is a reason for tumor or not, that is given by this Ewing postulates. There are few points which have to be satisfied. We'll discuss about that. Number one, the first point is the tumor site before the injury, it should be perfectly normal. Right? It should be perfectly normal, and there should be an adequate trauma. It should not be a very minimal or trivial trauma. There should be a significant trauma. After the trauma, there should be a time interval between the tumor development and the trauma. There is a trauma, there should be a significant time interval between the tumor development, before the tumor development. That is important. And remember, the tumor should originate from the same site of the trauma. Right? You cannot have trauma in the left forearm and tumor in the right forearm, and you can't say that the tumor is because of the trauma that you sustained. It's not like that. It should be from the same site. It should be from the same site, and it should be the same histological type. So when all these points are satisfied, you can say that the tumor is because of the trauma that was sustained. Right? The tumor site before the injury was should be perfectly normal. There should be a significant trauma, and after the trauma, there should be a time limit. After the trauma, there should be a time limit. The time limit which is given by this Ewing postulate is, it should be adequately somewhere between 3 weeks. It should be 3 weeks to 3 years. Right? It should be 3 weeks to 3 years. And remember, the tumor should originate in the same place of the trauma, and it should be the same histology. Fine. So these are the Ewing postulates that is giving us the correlation between trauma and the tumor.